Moving on to muscles that move the head and the neck. There are a lot of muscles that act on the neck, around 30, depending on how you decide which muscle belongs in this group versus another group. They support and stabilize the head and change the position of the neck and upper parts of the vertebral column. They help with chewing, swallowing, and breathing. We are only going to learn one single muscle from this group, only one single muscle. It's the sternocleidomastoid muscle. The origin is the sternum, the manubrium, and the clavicle, the sternal end. The insertion is the mastoid process of the temporal bone. So this is another case where the origin is inferior to the insertion, kind of going against our rule that often the origin is the more superior or more proximal attachment point. The action of the sternocleidomastoid varies depending on whether the right and left sternocleidomastoid are acting together. If so, when they contract, they cause flexion of the neck forward. In addition, when they act bilaterally, they can elevate the clavicle, sternum, and ribs to assist in respiration. Ordinarily, they do not have this action, but in respirations that need assistance, they can act as what's called accessory muscles and help by elevating the clavicle, sternum, and ribs. We'll learn more about their action when we do respiratory system. If the sternocleidomastoid on the right or left is acting alone, the action can be lateral flexion towards the same shoulder or rotation of the neck to the opposite side. And you can use your sternocleidomastoid muscle to perform these actions and convince yourself that these are truly actions that the sternocleidomastoid. I recommend doing that. All right. Moving on to muscles that move the vertebral column. There are many muscles in the back, and they are divided into extrinsic and intrinsic muscles. Extrinsic muscles include the superficial and intermediate muscle layers. Superficial muscles are associated with movements of the shoulder, and intermediate muscles are associated with movements of the thoracic cage. Intrinsic muscles are associated with movements of the vertebral column. And the intrinsic muscles are actually divided into their own superficial, intermediate, and deep layers. So just kind of, mark what layers we're talking about, so that you don't get confused about what we're talking about. So this picture here is showing back muscles. It's showing in the top two pictures extrinsic muscles, the superficial and intermediate layers of the extrinsic muscles. And the bottom picture is showing intrinsic muscles. These are the muscles that would be associated with movements of the vertebral column. We won't use this muscle to learn about the intrinsic muscles and how they're divided into superficial, intermediate, and deep layers. It actually gets really busy in there, but just keep in mind that the first two panels are the extrinsic muscles and the bottom panel is the intrinsic muscle. And then next slide, the intermediate muscle layer of the intrinsic muscles are the erector spinae muscles. And this is the only group of back muscles that we're going to learn. Okay, the erector spinae muscles are arranged in three groups themselves. The iliocostalis is the most lateral group. The longissimus is an in-between group, and the spinalis group is the most medial group. And if you look over here on the picture, you'll see that they are three groups of muscles that look like long straps that are on either side of the vertebral column, which they move. And this is a very simplified picture of the back muscles. And I chose it because it actually makes it possible for us to make sense of this complicated area. The erector spinae muscles are chosen as the muscles you will learn because they are the most important extensors of the vertebral column. And extension of the vertebral column is very important. When we went from being four-legged animals to two-legged animals, we had to kind of rear up on our hind legs, and extension of the vertebral column became very important and a bit of a problem for the body. It remains that the body has more weight towards its anterior than it does towards its posterior. So these muscles have to do a lot of work just to keep us in an erect position. And hopefully this name is evocative of the function of the muscle. So all of the erector spinae muscles originate on thoracic, cervical, thoracic, and lumbar vertebrae, and also on the sacrum and the ilium. They insert on other vertebrae and on the ribs. The origin and insertion can be described with great complexity. but I would prefer if you just get a general idea rather than going into the minutia of where all of these different muscles originate and insert. If you're interested, you can look at a table in Martini's and see there is just a gigantic amount of detail. What is the action of the erector spinae muscles as a whole group that includes the three subgroups? Well, when acting bilaterally, they extend the vertebral column. When acting on the right or the left alone, they produce lateral flexion and rotation of the vertebral column to the same side. Now, here's a picture of movements of the vertebral column. The man here is showing extension of the vertebral column, sort of making like a little back bend, we would call it. Then lateral flexion of the vertebral column and rotation of the vertebral column in the right picture. The quadratus lumborum is a muscle in the lower back. It is deep to the erector spinae muscles. The origin is on the iliac crest. The insertion is on the lumbar vertebrae, transverse processes, and rib 12, which you can clearly see in the picture here. The action: when there's bilateral contraction, extension of the lumbar vertebral column, stabilization of the diaphragm during inhalation, and fixation of the floating ribs during forced exhalation. You can practice all of those movements and imagine how the quadratus lumborum is acting. If the right or the left quadratus lumborum contracts alone, it will produce lateral flexion of the vertebral column to the same side. Okay, this next section gives an overview of the muscles that move the rib cage and muscles that move and support the walls of the abdominal cavity. So the muscles that move the rib cage and move and support the walls of the abdominal cavity are found from the neck to the pelvis and from the vertebral column posteriorly to the anterior midline. The muscles are organized into two groups, an oblique group and a rectus group. The oblique and rectus groups are divided into three groups: a cervical, thoracic, and abdominal group. The external and internal intercostals are oblique thoracic muscles. They are found between the ribs. The external intercostals and internal intercostals and the diaphragm move the rib cage during breathing. The external oblique and internal oblique and transverse abdominis are oblique abdominal muscles. They compress the abdomen, flex and rotate the vertebral column. The rectus abdominis is a rectus muscle. So this is the first rectus muscle we're going to learn. This muscle is an important flexor of the vertebral column and is an antagonist to the erector spinae muscles that we just learned. The diaphragm shares a common embryological origin with the rectus group. Therefore, it is placed in this group in anatomy, even though the diaphragm does not look like a rectus, which again, the word means straight, does not look like a straight muscle. Nonetheless, it is put in this group because of its embryological origin. So that was an overview of the groups of muscles that move the rib cage and move and support the walls of the abdominal cavity. So now we're going to concentrate on the muscles that move the rib cage. These muscles are involved in respiration. The muscles we will learn are the external intercostals, the internal intercostals, and the diaphragm. The external intercostals originate on the inferior border of the superior rib and insert on the superior border of the inferior rib. Their action is to elevate the ribs for inhalation. Now, inter means between, and costal refers to ribs. So between each of the ribs, there are external intercostal muscles, okay? If you look at the picture, all of the muscles that are slanting obliquely in a sort of direction of a V are the external intercostals. They are between each rib, each superior and inferior rib. And understanding that, you can look at the cutout and look at how the external intercostal originates on the inferior border of the superior rib. That is the point that does not move in the movement, and then inserts on the superior border of the inferior rib. That is the point that would move during the action of the external intercostal. So the superior rib would be pulling the inferior rib upwards, okay, elevating the ribs as a group, okay? And this helps us with inhalation. Okay, then the internal intercostals, they originate on the superior border of the inferior rib and insert on the inferior border of the superior rib, and they depress the ribs for exhalation. Now, usually exhalation is a passive process. We do not use muscles to exhale, but we can force an exhalation, like as if you were like blowing out to blow out birthday candles. And in that case, you can um, use the intercostals to, depress the ribs. Okay. And now, if you look at the origin on the little cutaway picture being on the inferior rib and the insertion being on the superior rib, and these muscles pulling towards the origin, you'll see that they are acting to pull down the superior ribs towards the inferior ribs. The diaphragm is a dome-shaped sheet of muscle that separates the thoracic and abdominal cavities, as we learned long ago. The origin of the diaphragm is found all around in a whole circle around the whole rib cage, in particular on the anterior surfaces of lumbar vertebrae and on ribs 7 through 12 and associated rib cartilages, and then finally anteriorly on the xiphoid process. The insertion is the central tendon of the diaphragm. The central tendon is in the center of the diaphragm. It's kind of shaped like a boomerang here. It's shown as a white patch in the center of the diaphragm in that picture. And the diaphragm's action is quite interesting. When the diaphragm contracts, it pulls on the central tendon from all sides. This flattens the diaphragm and increases the volume of the thoracic cavity. And this actually causes inhalation. The diaphragm also, when it's flattening like this, compresses the abdominal pelvic cavity. When the diaphragm relaxes, it rises superiorly or domes back up, as they say. This decreases the volume of the thoracic cavity and helps cause exhalation passively. The action of the diaphragm accounts for 75% of the work of breathing. Moving on to muscles that move and support the walls of the abdominal pelvic cavity. The oblique muscles that move and support the walls of the abdominal cavity are found in 3 layers. The most superficial is the external oblique. It slants downwards like a V. The external intercostals also slant downward like a V. The intermediate oblique muscle is the internal oblique. It slants upwards like an A, and the internal intercostal also slants upwards like an A. The deepest oblique muscle doesn't really run obliquely. It's called the transversus abdominis. Nonetheless, it is in this oblique group, and it runs across the abdomen. If you look at the cross section here, it's a very helpful view. It shows the external oblique, external to the other muscles, the internal oblique between the 2 muscles, and then the deepest muscle, the transverse abdominis, all shown in cross section. I strongly recommend that you look at this picture. It is extremely helpful in learning where these muscles are, rather than just using the top picture I have here, which is showing the different layers in cutaways where needed. So there's the external oblique on the outside, and then that layer is cut away to show the internal obliques, and then that layer is cut away to show the transverse abdominis. The rectus abdominis has its own, area in the anterior abdomen that it is found in. It does not overlie the 3 oblique muscles, as you can see in the cross-section picture quite clearly. Rather, in the upper picture, what you see are broad tendons called aponeuroses that are coming from the 3 oblique muscles and forming a rectus sheath. Well, I'll explain separately, it'll be clearer perhaps. So the external oblique, the superficial layer, the fibers form a V shape. You can think of the direction of the fibers being the direction that you put your hands in when you put your hands in your pants pockets. Okay, sort of in a direction of a V shape. The origin is the external and inferior borders of ribs 5 through 12. The insertion is the aponeurosis that extends to the linea alba and the iliac crest. The actions are compression of the abdomen, flexion and lateral extension of the vertebral column, depression of the ribs, and with the linea alba as an origin, rotation of the vertebral column to the opposite side with the help of muscles on the opposite side of the abdomen. The internal oblique is the middle layer. The fibers form an A shape. The origin is the iliac crest and thoracolumbar fascia and the inguinal ligaments. The insertion is the inferior surfaces of ribs 9 through 12, costal cartilages 8 through 10, and the linea alba and pubis. And over here in the bottom picture, I have marked off where the iliac crest is. You remember that from our bone lectures. The thoracolumbar fascia is a big diamond-shaped area of fascia on the back. Remember, fascia is just like a very strong sheet of connective tissue. And then the inguinal ligament, which we haven't learned yet, is shown in the upper picture, and it runs from the anterior superior iliac spine, which you can see in the picture, down to the pubis, which is a little lost, but you can see the pubis in the bottom picture. That's where the inguinal ligament is, and it will show up again in future lectures. It's an important ligament and landmark. All right. The transverse abdominis, the deepest layer, the fibers run across. The origin is the iliac crest, the thoracolumbar fascia, and the cartilages of ribs 7 through 12. The insertion is the linea alba and the pubis. And the action is compression of the abdomen. The rectus abdominis has fibers that run up and down, straight up and down. The origin is actually the pubis. The insertion is the inferior surfaces of cartilages of ribs 5 through 7 and the xiphoid process. The action is flexion of the vertebral column, depression of the ribs, and compression of the abdomen. And there are some connective tissue structures that are commonly taught that you're expected to know. The linea alba, which is a mid-sagittal band of connective tissue, marked off here in the upper picture as a white line between the right and the left rectus abdominis. Then tendinous inscriptions, which are transverse bands of connective tissue. Together, the linea alba and the tendinous inscriptions form the six-pack that one hopes to get at the gym. The rectus sheath surrounds the rectus muscle, and it is formed by the 3 oblique muscle sheaths. So if you look at the cross section, you'll see that the 3 oblique muscle sheaths come together and form the rectus sheath, which then surrounds the rectus muscles. And finally, the rectus sheath comes together at the linea alba. Okay, now finally, the muscles that move and support the floor of the pelvic cavity. You do not have to learn any of these muscles as part of the coursework. However, they are extremely important muscles. So I hate to leave them out. So here they are. The muscles that move and support the floor of the pelvic cavity are found in the perineal region, which is the area of the pelvic outlet. This region is divided into the anterior urogenital triangle and the posterior anal triangle. The urogenital triangle has a superficial layer of muscles associated with sexual function and a deep layer of muscles that supports the pelvic floor. The bulbospongiosus and ischiocavernosus muscles are found in the superficial layer and are important in sexual function. The external urethral sphincter is found in the deep layer and it surrounds the urethra. This picture shows a superficial dissection on the left and a deep dissection on the right. Therefore, the superficial muscles are shown on the left and the deep muscles are shown on the right. So that was the urogenital triangle, and I will go back to these bulbospongiosus and ischiocavernosus muscles at the end when we do reproduction. And we will go back and learn about the external urethral sphincter when we do the urinary system. The muscles of the anal triangle support the pelvic floor. The levator ani muscles support the pelvic floor and pelvic organs. They flex the coccyx and elevate and retract the anus. The external anal sphincter closes the anus. And we will go back and learn again about the external anal sphincter when we do the digestive system. And here's just an enlarged picture of the female pelvic floor and the male pelvic floor with their respective urogenital and anal triangles. There is not really much difference between them, with the exception of the urogenital triangle having some differences in the details of where the ischiocavernosus, bulbospongiosus, and urethral sphincter muscles are found, but they're actually quite similar. Well, that's that for now. See you soon.